All right. Well, good morning, everyone, and thank you for attending. With today's webinar, I hope to kind of give you a little bit of lots of information, actually, and kind of educate you in regards to how things transition when you become Medicare eligible. Okay. And hopefully it'll save you some money because the Medicare plans are lower in premium than the non-Medicare plans. So we'll move along and see what we can learn today. Okay, so during today, we've already done the introductions. I'm going to provide you a Medicare overview, a SARA and the Medicare mandate, Medicare and how it works, Medicare plan options that a SARA has for you. And of course, we'll be able to take quick questions. Okay. All right, so who is eligible for Medicare and who's involved? Okay, normally Medicare is when you start to as you reach age 65 and older, you should be Medicare eligible. Everybody can apply for Medicare once they reach age 65. There are those who are under 65 and they have a disability. If you have a disability, according to Social Security, if you have a disability and you've have this disability for at least 1 year, then you should be able to apply to Social Security based on that disability. And they have their own criteria as what they deem disabled. And then they may grant you your Medicare early, okay, which is good because then that means you get to move on to a Medicare plan and pay lower premiums than the pre-65 standard plans, okay? Of course, anyone with ESRD or Lou Gehrig's disease, of course, Social Security Administration, and then we call it CMS, but it's the Center for Medicare and Medicaid Services. Okay. All right. So, if you're currently receiving a Social Security check, the way that they say it is, Social Security says that you're going to automatically be enrolled. Sorry about that. You're going to automatically be enrolled in Medicare. Okay, and they'll send you your Medicare card. Medicare they've gotten better. They've been prior to COVID, they were pretty good at getting the cards out. Of course, COVID hit, a lot of people started to work remote, and some of these services kind of got backlogged a little bit, so it took a little bit longer to get their cards out. But it looks like they're getting cards back out expediently to everybody more timely. Okay, so it's not uncommon that someone may get their card, 2-3 months in advance. Sometimes you get it the month before or even the month during. So you just gotta make sure that you reach out and check in with them to make sure that they have all your current information so they can provide you and get you enrolled in process to have your Medicare Parts A and B. Okay. Now, Medicare Part B does have a premium and it will be deducted from either your Social Security check or they will direct bill you. Now, when they direct bill you, they bill you for 3 months worth because they bill quarterly. Okay, so it'll be 3 months worth of the Part B premium. And we're going to go over the premiums in a couple of slides. So your Medicare card will automatically be mailed to you. And one of the good things now is that on the Medicare card, it no longer has it still has your full name, but it doesn't have your Social Security number with an alphabet letter after it. Okay, they've now figured out that, hey, people intercept mail or people lose their cards, and now someone has your full name and your Social Security card and your signature if you sign the card, which is not a good thing. So they've switched over and have now given everybody an identification number that identifies you as a Medicare recipient. And you'll notice that once you see your Medicare card. Okay. Now, some retirees or dependents who are disabled may be eligible for Medicare earlier, which is good because then you get paid lower in premiums because they can transition over to a Medicare plan. Okay, so that'll save you some money on that because they get it earlier instead of waiting all the way to age 65. Again, you would have to reach out, or they would have to reach out to Social Security in regards to the criteria based on Social Security, whether or not they're deemed eligible to be granted that early. Okay. Okay, so if you're not receiving a Social Security check and you're holding off to a higher age so that you can get a bigger payout, and that's fine, you can do that, but you want to let them know that, hey, I'm 65, I do want to get my Medicare, but I don't want to start getting my Social Security check just yet. You just got to let them know. And we encourage you to start the process at least 90 days prior to your 65th birthday. Okay. So the birth that you turn 65, 93 months before, you want to go ahead and start reaching out to them and making sure that they have all the current information. And if they have any questions or anything, you can provide that to them. And that way they can start the process to get you enrolled with the Medicare. Okay. Again, you can call that Social Security 800 number there. You can also go online to their website and enroll online. Okay. So they will only talk with you, the actual payee. They won't talk to a second party. So like I can't call on your behalf, say, hey, they need your Medicare. They will only talk to you, the recipient. Okay, just be mindful of that. Okay, so Sarah's Medicare mandate. Okay, so basically when you or your dependent become Medicare eligible, which is usually at 65, in order to continue enrollment and be a recipient of the Medicare plan, you must complete the enrollment process into a Sarah-sponsored Medicare medical plan. Okay, so you have to transition. You can't just, some people will say, well, I'm already on the Kaiser and I'm fine. I'm good. Everything's taken care of. I can pay my copay. Okay, but you're Medicare eligible now, so you need to transition to if you want a Kaiser, you have to go over to the Kaiser Senior Advantage Plan, which is the Medicare plan. Okay, so you must go ahead and get your Medicare. That way you can transition over to the Medicare plan. And you'll see why and how you can save money in a couple of slides. I'm going to go over those premiums and you'll see why you want to do that, because you can save some money. And some of it is pretty substantial. Okay. Again, this Medicare, this mandate applies to retirees who are receiving the monthly medical allowance. Okay. So you need to transition over so that we can go ahead and adjust your allowance properly as far as what we supplement towards your plan. Okay, so currently the carrier that Acera offers with the Medicare group plan is the Kaiser Permanente, which is the Kaiser Senior Advantage plan. Okay, and we're going to have a summary of that plan, like I said, in the next few slides, and kind of show you how your costs can go down by going ahead and enrolling into that plan. So those who do not wish to enroll in Kaiser Permanente Senior Advantage can contact Via Benefits to get enrolled into an individual Medicare plan that's nationwide. Okay. So Medicare Via Benefits can assist you to enroll into a Medicare plan, that's nationwide, and we'll be able to get the Medicare plan taken care of that way. Okay, so they'll assist you to get enrolled and find the best plan suited for you.
Ish, there is a question.
Yes.
And the question is, I'm a retired safety member. I do not have enough Social Security credits to be eligible on my own. My wife is retired and she is collecting Social Security and she is on Medicare. Confirm for me that I will be eligible for the premium-free Part A as a spouse under my wife's work history.
Okay. So if you're on our Kaiser Permanente plan, okay, and you become Medicare eligible and you contact Social Security and they say that you didn't pay in or whatever the case is, and they want to charge you for the Part A, you can simply go ahead and just enroll in the Part B premium. Don't enroll into the Part A. Okay. And what happens is Kaiser Permanente, we do have a Part B only Kaiser Senior Advantage plan. Okay. So as long as you can get your Part B, then you can still transition over to Kaiser Permanente Senior Advantage and enjoy the benefits of the lower premium and lower copays. Okay, and just waive the Part A. Don't enroll that part in the Part A, because the Part A, they're going to charge you. It's up there. It's around $500. I'm going to have a slide coming up that's going to kind of show that. Okay, so the other thing is that based on that your wife is eligible for Medicare, and you can always talk to them in regards to eligibility as a spouse under her eligibility. Okay, so that's another way you can check. If they try and tell you that they're going to charge you for the Part A, okay, based on your record, check in with them in regards to, okay, well, my wife is Medicare eligible or has worked all the quarters. Do I qualify as a spouse for under hers? And then they can check and they can go ahead and go over those options with you to see whether or not, yeah, you do qualify for it. There are certain stipulations to that. The spouse has to be over a certain age. I believe it's like age 62. But they can go over all those items with you at that time. Okay.
Thanks, Ish. Another question just popped up. Question is, I'm not enrolled in any Acera health plan right now. I've applied for Medicare as I'll be turning 65 in October. As soon as I get my Medicare card, I plan to enroll online through Acera and the Kaiser Permanente Senior Advantage plan. My question is, do I need to wait until open enrollment in November to do that, or can I enroll as soon as I hear from Medicare?
Okay, good question. Okay, becoming Medicare eligible is a qualifying event. It's not an open enrollment item. Okay, just because it's happening around October, which is just before open enrollment, which is the month of November. Becoming Medicare eligible is a qualifying event, which allows you to make transition to a different plan. Okay, so because you're getting your Medicare, that will qualifies you to enroll into our Kaiser Permanente Senior Advantage plan. Okay, you don't have to do it through, it's not an open enrollment item. Okay, so it's quite all right.
Great. There's a comment, I'm Medicare eligible, but my husband is not yet. Is that a follow-up from the first question? Let us know about that.
Okay, and that's fine. If you're both on the Kaiser plan and one of you is becoming Medicare eligible, the one that becomes Medicare eligible would transition onto the Kaiser Permanente Senior Advantage plan. Okay, they would complete the Kaiser Senior Advantage election form, and the person that's not Medicare eligible, they would just remain on the Kaiser HMO as they are. Okay, and then once they become Medicare eligible, then they can go ahead and complete the Senior Advantage election form and also go on to the Kaiser Senior Advantage plan.
Great. And then there's a hand up. So if you want to go ahead and ask your question, feel free to unmute yourself and ask that question. Or maybe that was the same question that you typed in.
Yes, that I've already asked that.
Okay,
Yeah.
great. Okay. Oh, wait, one more question just popped up.
Okay.
So the question is, I'm employed at Alameda Health System on their medical plan. I've applied for Medicare and I'm waiting for my Medicare card. I will retire in March of 2023. Do I still need to enroll in the Acera plan via Benefits Now?
Well, unless you're already retired and receiving a monthly benefit from us, you can't enroll into one of our plans. Okay, you have to be a retiree to be able to do that. So if you're still, there is a section coming up that I'm going to talk about the working aged. So if you're still working and you're on an employer plan, or you're not even on an Acera plan, you're on your spouse's plan. Okay, that's fine. As long as you're on an employer plan, you can technically waive enrollment into Medicare until you come off of that plan. And then you won't have to worry about paying Medicare premiums to Medicare for Medicare because you're on an employer plan through your dependent or your own employer. Because what's going to happen is Medicare is going to see that you are on an employer plan, and they're not going to pay for any claims or services through Medicare. Okay, they're going to say, yes, I see we got your claim for services, but your employer plan is primary, so we're not going to pay any of this bill. It's going to be basically based on back to your employer group plan. And most employer group plans are going to be pretty much cover everything 100%. So Medicare is not going to be paying any for any claims or anything like that. So basically, you'd be paying premiums to Medicare for basically you're giving them money because they're not going to pay anything if you're on another employer plan. They're going to look at that plan as being primary. Okay, so you can always still contact them, if you become Medicare eligible, and let them know that, hey, I'm 65. I know I'm Medicare eligible, but I'm still on my employer plan or my spouse's employer plan. So I want to waive my Medicare until I come off that plan, and then I can reach back out and have you activate my Medicare. Okay, and that'll save you from having to pay premiums to Medicare that they're not going to even pay any claims for. Okay.
Awesome. And they say thank you.
You're welcome. You're welcome. Okay, so here's a screenshot that kind of shows you how you can save some money. For example, this person, this member has 17 years of service. Okay, they're turning age 65, Medicare eligible. They're on Kaiser HMO, and that monthly premium right now is $843.16. The MMA, or the monthly medical allowance that Sarah pays towards the medical plan for that retiree, is $447.55. That means on their monthly benefit check that they get from Sarah, they'll see the Kaiser deduction of $843.16, and then on the trying to look at it on the left side, on the one of the lower boxes, you'll see the non-taxable subsidies where we're putting in a credit of $447.55. So basically, the net difference is what you're out of pocket monthly. So this person's out of pocket $395.61 every month. This person becomes Medicare eligible. They enroll into our Kaiser Senior Advantage plan, okay? And that premium this year is $344.44. The subsidy that we pay, we're gonna pay $340.44. So now their out-of-pocket monthly is zero. So they're right there, that's $395.61. They get to stay in their net monthly benefit check, okay, that they get to utilize and spend. Okay, so that's a pretty good savings. It's a pretty good savings. And of course, I'll be covering in a moment a screenshot that talks about senior advantages. You'll see how the copays also drops down.
Okay, there's one hand up. So if you want to go ahead and unmute yourself and ask your question, feel free to do that.
Good morning. Can you hear me?
Yes.
Yes, we can hear you.
Good.
Good morning.
Good morning. Good morning. I have a situation. I turned 65 in September. I received this package, so I completed the transitional to your Kaiser senior plan.
Mm-hmm.
And I contacted Social Security, and I told them right now I'm currently working part-time. So since Sarah is contributing to my medical, that I really didn't think I needed to apply for Medicare right now, but the paperwork is telling me I have to. So
Well,
is
yeah,
that true? I have to at age 65? I don't have a choice, even though you all are paying my medical?
Well, you have a choice, but if you're on an Acera plan, and yes, you may be working part-time, that's fine. You would still want to go ahead and apply for this for the Medicare, because as you can see right here, because are you on the Kaiser plan?
Yeah, I'm right now I'm on the HMO, but I just completed the package to transition to your senior advantage when I turned 65.
Okay, and then clearly from what you see on the screen, you would want to go ahead and apply for your Medicare, because you can see how you're going to save some money. We're going to, I mean, $395 back onto your, your monthly benefit for you to spend. That's pretty good money. So you do want to apply for it. That way you can save some money.
Okay.
And be able to enjoy that, because everything's going up in price.
It is.
Gas, groceries. Oh my goodness. So any little bit more that you can get monthly is always a plus.
Okay, thank you.
Okay, you're welcome.
Okay, and there's one more question up on the board, which is typically how long does it take to be covered by a Kaiser Permanente Senior Advantage plan from the time of enrollment through Acera?
Okay, so it's based on when you became Medicare eligible. Okay, so for example, and of course, and when you submit the forms. So you always want to submit the forms prior to the first of the month in which you turn 65. So for example, the lady who just spoke, she's becoming 65 in September. So as long as we can get your submission of your Kaiser Senior Advantage election form, now in August, now in July or sometime in August, and my team can go ahead and get that over to our Kaiser team. We have a designated Kaiser team over at Kaiser that works with us and handles our members. Okay, so it's not just the general customer service team. So we get your form, we review it, make sure everything's completed, you sign it, we get it over to the team at Kaiser. They turn around, process it, get it to Medicare. That way Medicare can go ahead and do the approval. Okay, sometimes it goes pretty quick. Sometimes it may take a month or so, depending, because Medicare has to do some kind of review, but typically it goes pretty quick. Once Medicare gets it, they review it, they see you're eligible, you're elected to be on the Kaiser Senior Advantage plan, then they go ahead and authorize the effective date. So they would have authorized, like for the turning 65, it's always the first of the month in which you turn 65, unless your birthday falls on the first of the month. Then they make it effective the first of the month prior. Okay, so they would send over the approval effective date to Kaiser, the Kaiser team, and they send a report to us letting us know, hey, Medicare has approved these members for Senior Advantage effective this date. So you would show up on that report as being effective, for example, September 1st. And then so we would go ahead and do the changes in our system to change the deduction from the HMO down to the Senior Advantage plan. If the report doesn't reflect you as being approved just yet, you'll still see the HMO deduction of that $843. Okay, and then once the report comes and if it does say, okay, yes, this person was approved as of back at this date, then our team will go ahead, they'll make the change for the deduction, and they'll also do a adjustment to refund you any overage. So they'll refund you back the $843 and charge you correctly for the $344. Okay, so it all depends. Sometimes it does go pretty quick. Now, once you send it in to us and we forward it to Kaiser, if you get a letter or a phone call from Kaiser's Medicare team, sometimes there might be something on the form that you may not have explained, or something that they need to clarify. They may reach out to you just to clarify the question or something. And make sure you respond back to that letter or the phone call, okay? Just to make sure that they got everything that they need so that they can continue forward with the processing. But it usually goes pretty quick.
Okay. Oh, wait, do you recommend applying online or through paper?
For the Senior Advantage plan or Medicare? For Medicare?
For the Senior Advantage plan.
Well, I'm sorry, I couldn't hear you. If you're talking
for
about
the
Medicare,
Senior Advantage plan.
the Senior Advantage plan,
Yeah.
well, we have you on. We have the form that we sent out to you, and that's what we'd prefer you to go ahead and complete. That way we can get it back and make sure that everything is in order. You got all the information there, and we can go ahead and, like I said, we get that over to Kaiser team for processing. We do that all encrypted, secured. So no one's going to be able to have your information other than Kaiser. That way they can go ahead and process and get things going.
Are you all sending people the link to the DocuSign form yet? Or are you still sending the form out in paper?
I believe that's in, well, for this webinar, we send out a copy, a printed copy, a hard copy of the senior election form. If you do want to just go ahead and just do it online, on our website, there is a Senior Advantage form that you can complete online and submit in. Okay, so you can do that if that's easier for you, that's fine. And then our team will get that, and they'll go ahead and verify it, and they'll get that over to the Kaiser team for process. So you can do either way. Either way is fine. Whatever is more convenient for you.
And let me just show you where you all can do that. If you go to acera.org and you click on forms, and you scroll down to the Kaiser Permanente Senior Advantage enrollment form, if you click the DocuSign button, that will open up DocuSign, and then you can do the form completely online. You don't have to worry about, like scanning it in or mailing it to us or printing it out or any of that stuff.
And the good thing about the DocuSign one, it pretty much walks you through the form step by step by step. And if you happen to miss a question or didn't complete something, it lets you know that you need to complete an item before it lets you get to the end and finish out. And it also, now you have a digital copy, and it's all secured, so you don't have to worry about someone else getting your information, because the DocuSign is all secured.
Okay, I think we're good.
All right. So what is Medicare Part A? Okay. Well, when you become Medicare eligible, okay, Medicare Part A provides the hospital insurance portion. So Part A helps pay for Medicare-approved hospital stays, skilled nursing facilities, rehab, not long-term care, but hospice care, home health care, blood, um, hospital care from qualified Medicare providers. You typically do not pay a premium for Part A coverage if you paid Medicare, paid into Medicare while you were working. In some cases, some positions may not have did the deduction for the Medicare. Usually like if it's a safety member, chances are they may not have been paying into the system completely like Social Security anticipates. So in that case, that's why for those members, if they say that, hey, we're going to charge you for the Part A, you want to just waive the A and just get the Part B, okay? That way we can transition you onto the Medicare Part B only plan. That way you don't have to worry about having to pay a premium for the Part A. But for all other general members that we worked for the county and so forth, pretty much, yeah, the county took the deductions out of our paychecks. So as long as you did the 40 quarters, you should be fine.
Oh, and there's a question that just popped up.
Okay.
If I don't want Kaiser, does VIA have Medicare plans that I can add my spouse who is not 65 yet on one plan?
Yes, VIA has plans for under 65, and they also have Medicare plans. They have all these items. It's done over the phone, so it's like a big phone interview. So basically, all the pertinent questions that you would normally see on an enrollment form, they're going to be asking you all those questions. Okay, and then some. Then they'll go ahead and get you enrolled, and you can have them help you get your dependent enrolled also. Okay.
Okay.
All right. So enrolling in a Medicare Part A plan, okay. For the majority of us, like I said, most of us, we pay nothing for the Part A. But if they are going to charge you, if you see under the quarters, 40 plus, pretty much it's free, Part A. If you did not complete 40 quarters of paying into the system, then they're going to charge you a slight premium, like 240, 274. And if you didn't pay it at all, they're going to try to charge you $499 a month for the Part A. Okay. So for 2022, if you didn't pay in at all, they may try to get you to pay $499 a month to have the Part A. Okay. So if you don't get Part A for free, then you want to go ahead and contact us so we can make sure that we got you clear as far as to just get the Part B. Basically, all you got to do is just get the Part B. If they're going to try to say that they want you to pay for Part A, waive the A and get the Part B. Okay. In most cases, if you choose to buy Part A, you're gonna you have to have Part B. And Part B, there is a premium, and you would have to pay both the premium for Part A and the premium for Part B. Okay. There is a late enrollment penalty if you don't enroll into it timely. So when you first become eligible, and everybody becomes eligible at age 65. Okay, that's why we're trying to get this information out to you ahead of time so that you can go ahead and start the process. But there is a 7-month window, and I'm going to cover that in the next couple of slides. But you do want to try and contact Social Security and get enrolled prior to turning 65. Okay, so you want to make sure you get that done. If you wait beyond the eligible 7-month window, then they may charge a late enrollment penalty, and that's just more money they have to pay out. Okay. So, and that higher premium for that late enrollment penalty, they charge you that additional late fee for twice as long as when you should have enrolled. So if you should have enrolled and you were 4 months beyond, and so they charge you the penalty, then it was 4 months, then they're going to charge you the penalty for 8 months. So they're going to charge you that, and then they'll finally drop off. What is Part B? Well, Part B provides the medical insurance portion of the Medicare. Okay, so of course it helps to pay for doctor services, outpatient, preventive care, diagnostic tests, supplies, things like that. Okay, so there is always a premium for the Part B. Okay, for most Medicare eligible individuals, okay, the monthly premium in 2022 is 170.10, which is the lowest standard monthly premium for the Part B premium that they're charging this year. Okay, so some members may pay more depending upon their income. I'm going to cover that in a chart that's coming up. This premium is usually deducted from your Social Security check. Otherwise, like I said earlier, they're going to bill you quarterly, so they'll bill you for 3 months worth. Okay. Again, many preventative care and supplies, all these items are covered under that. So you do want to make sure that you got both Part A and B, if you can get both. Otherwise, as long as you get Part B, you should be good. Okay. And you can always go onto their website and take a look at what the Part B covers. There's a book that you can download or just view it online. It's called Medicare and Me, or Medicare and You, and it always has the most current year. So 2022 Medicare and You or Medicare and Me, and it has everything that's covered under Medicare. It's like 100 and something pages. So you can always go through that. And you can pinpoint down if certain services or items are covered by Medicare. Next screen. All right, so enrolling in Medicare Parts A and B, okay. Like I said, if you're not already getting Social Security, you want to reach out to them, at least 3 months before your 65th birthday, okay. Again, you can apply to Social Security online, or you can give them a call. You can visit the Social Security office. However, if you're going to go visit the Social Security office, I do recommend that you call ahead and make an appointment. Otherwise, take a good book, because you're going to be sitting there just like DMV. No, what's called DMV, but you're going to be there for a while. Okay, so it's always good to make an appointment if you're going to walk into a Social Security office to meet face to face with one of the Social Security agents. Okay, from what I hear from members, when they make an appointment, they're usually seen within minutes of their actual appointment time. Okay, so you want to fill out an application for enrollment in the Medicare Part B. Of course, you can submit it in person, or you can go ahead and mail it in. Okay. Now, keep in mind, completing the application form and submitting it does not automatically enroll you in Medicare Part B. Social Security is going to have to review it and make sure they're going to check their system to see where you fall as far as eligibility. Did you pay in quarters, all that stuff, and they'll go ahead and they'll respond to you. You'll get the notification. Is there a question there, Mike?
Good morning,
Oh,
Kenny.
Yeah, go ahead.
Yeah, I just wanted to comment on the Social Security office. I recently applied for Medicare about 3 weeks ago, and I went into the office in Walnut Creek on Friday. I had no problems at all. I was in and out within 15 minutes, and they were extremely helpful. And I just thought I'll mention that.
Good. All right. Thank you. Yeah. All right. Woohoo. All right.
There's also a question. Actually, let's see. There's another hand up. So go ahead and ask your question if you would like. Okay, maybe that was in a hand from before. So I'll just go ahead and lower it. If you do have a question, feel free to raise your hand again. And then there's a question on the board, which is, my wife and I are retired. I currently have medical coverage through Acera's non-Medicare Kaiser plan. I also have a second medical coverage through my wife's retirement, which is with Anthem Blue Cross. So I turned 65 in January of 2023, and I'll be changing to Acera's Kaiser Senior Advantage plan during my transition to Medicare. So my question is, can I also continue to be covered under my wife's medical plan? In other words, can I be covered under 2 different medical plans while on Medicare?
Well, here's the thing about being covered, double covered like that when you become Medicare eligible. Medicare can only have one plan in their system. Okay, so they may send you a letter saying, hey, you need to choose a plan. You can't be on 2 on two Medicare. We can't assign Medicare to two different carriers. So if the Blue Cross that you have with your spouse, if they offer Medicare plans, then you want to make sure you check in with them as far as do they have Medicare plans, and then you can compare that plan, Medicare plan versus our Kaiser Senior Advantage plan. Cross-reference the services, cross-reference the copays, what the premium costs are going to be for you, and then you can make a determination which one you're going to go to have the Medicare assigned to that. But you can't have Medicare assigned to two separate plans. Okay.
Great. And it looks like the person, so you have your hand up. Do you want to ask your question? Feel free to unmute yourself and ask your question.
Hi, am I unmuted now?
Oh, great.
Yes.
Yep.
Hear you.
Oh, okay. So I'm turning 60. Right now I have HMO, Kaiser. I'm applying for the transition. So does that mean I already have A? So all I need to apply for is B, since I already have hospital coverage through Kaiser HMO?
Well, hospital Kaiser HMO isn't part A. That's part if you become Medicare eligible, you still want to try to see if you can apply for both Part A and Medicare Part B. You want to get them both, and then we can transition you over to the Senior Advantage as long as you submit that election form.
So I need to apply for A as well, because I was thinking I have Kaiser. I already have hospital coverage.
Well, yeah, well, you have hospital medical coverage, yes, but as a non-Medicare enrollee, when you become Medicare eligible, you want to go ahead and apply for Parts A and Part B. Okay, if they say that they're going to charge you for the Part A, then waive the Part A and just get the B, and then we can still transition you onto the Kaiser Senior Advantage plan and save you some funds.
But apply for both.
Apply for both.
Because
Yeah.
I've worked for the county for almost 30 years, so I thought you said it was a given that we already have A.
No, it's not a given that you have A. No, not at all.
Oh, I
Not at
thought you
all.
said it was a given. Only the security and safety people didn't have A.
Well, it's a given that you've already paid in the quarters, so the Part A is going to be free. So yeah, you want to apply for both
Okay, it's
A
free.
and B.
Okay.
Once you enroll.
Only the members who are like safety members who may not have paid in all the quarters or may not have paid in at all because there's an exemption that they had.
Okay.
So if Medicare is going to say that you have to pay for Part A, then don't get the A, just get the B. But otherwise, you want to try to get the A and the B.
Apply for both. Okay, thank you.
Okay.
Okay. I think we're good.
All right. Okay. So here's that enrollment period that I was talking about, the 7 months. Okay. It's 3 months before you turn 65. Okay. The birth month, and then 3 months after. Okay. If you delay in enrolling Medicare or making the decision as far as which medical plan you want to go to beyond 3 months after you turn 65, then it's a late enrollment penalty. They're going to charge a lifetime penalty. It's a lifetime. So it's 10% for every 12-month period that you did not enroll in the B like you should have when you first became eligible at 65. Okay. So, and that's 10%. That starts to add up. I mean, the premium is already getting up there. You don't want to add additional penalties for lifetime onto it. So you want to start the ball rolling ahead of time, get your Medicare, and select the plan within that window. Preferably, you do it all before you turn 65, because if you go back to the screen where I showed you where that 17-year service member, their out of pocket for their HMO was like $395. If you could stop paying that $395, that's a good thing. I mean, I don't know how many people want to keep paying $395 extra beyond when they could have stopped having to pay that. And because if you do that, there is no retro back. We can't go back and give you the refund for that because you didn't apply to enroll. So it starts when you applying, submit the forms to us so we can have it, so we can get it over to Kaiser and get that ball rolling so we can get you adjusted down to the lower premium. So you want to make sure that you're following suit and doing your duty there to get enrolled and get everything processed before you turn 65. Okay, because we want to try to get the forms and to get you transitioned over to Kaiser before the month in which you turn 65. Okay. If we happen to get the forms and so forth, you submit it to us on the first of the month in which you turn 65, or that first week, then you're not going to get approved for that month. You're going to, chances are Medicare is going to approve it for the first of the next month. So that means that's an additional, deduction that's going to stay on your monthly benefit. So you want to try and get it into us as soon as possible prior to your age 65 birth month. Now, if your birthday falls in the first of the month, then your Medicare becomes effective the month earlier. So for example, let's say your birthday is September 1st, then your Medicare will become effective August 1st. It's always the month ahead when your birthday is on the 1st. Okay, so you want to keep that in mind too. Okay. Again, if you happen to miss the enrollment period window that you have, they do have a period where it's January through March of each year. Okay, but the coverage will begin. Your Medicare they'll make your Medicare effective July 1st of that year, which means all those months you're still paying that extra out-of-pocket deduction net. Okay, which you don't want to have to do that. That's okay. Again, and then you're also having to deal with the lifetime penalty. Okay, so now the exceptions is the working age. Those are the members that are eligible for Medicare, but they're still working and they're on an employer plan. Okay, they can delay enrollment into Part B until they finally retire, and then stop working, and then they can go ahead and get notify Social Security, say, hey, I'm going to stop working. I'm not going to be on my employer plan. I'm going to need my Medicare, and then they'll go ahead and boom, get you all set up. Okay. All right.
Okay.
All right. Employer plans. Okay. Or someone who's actively working. Okay. Again, you're still working. You're working on your employer plan. Okay. Or you're on your spouse's employer plan. Okay. You could delay Part B enrollment and use your employer plan. Okay. Because like I said, the employer plan is going to pretty much cover 100%. Enroll in Part A and B and have both Medicare and your employer plan, which is likely no benefit because, like I said, Medicare is not going to pay anything because they're going to say, hey, well, the employer plan is primary and they cover 100%. Okay. Or you can reject the employer plan, not a good idea, and enroll in Medicare and then supplement in other ways. Okay. So again, you want to make sure that you're keeping an eye out and making a good decision on that. So. Okay, so here's how they determine what you would pay for your Part B premium. Okay, as you can see, the first column to the far left at the top, filing individual tax return. And remember, they always do a 2-year look back. So right now we're in 2022. So they're going to look at your 2020 tax return. Okay, whatever you submitted for your taxes, that's what they're going to look at. Filing individual tax return, 91,000 or less. Slide across to the right. Then your Part B premium for your Medicare Part B is the 170.10. Okay. Going down, let's say you're above $114,000 to $142,000 reported on your IRS taxes. You slide across, then your monthly Part B premium will be $340.20. Okay. And you can see if you're filing joint on the second box there, second row, above $182,000 up to $228,000, and then your Part B premium is $238.10. Okay, of course, filing joint and your premium, your tax reportings of earnings is only $182,000 or less, then of course you're still at the 170.10. Okay. And the Medicare will, like I said, they'll deduct it out of your Social Security check, or they'll bill you quarterly, 3 months worth, and you must pay that premium to them, because otherwise they'll disenroll you from the Medicare, which causes your medical plan to then disenroll you, which means you won't have a medical plan and so forth, and it becomes a big mess. So you want to make sure you're making sure that that's getting paid timely. Okay.
Okay, question. What if I have part A and B, but a year later start working again with a private company that provides health coverage? Can I suspend part B?
Well, it's not, once you get Medicare, it's not recommended that you disenroll from it. You want to really talk to Social Security about that, because they, they'll stop it if you tell them you want to disenroll. Okay, but you want to be careful that when you finally come back, that they're not going to try and say, okay, well, you had it before, you dropped it, now you're coming back, so we're going to have to charge you a penalty or something. So you want to clarify with them regarding that. On this presentation, we do have Yolanda Smith, who is my co-part, and from Kaiser. Yolanda, are you aware whether or not if someone was to drop it and come back later to get it because they were on an employer plan, do you know if Social Security would charge them an additional penalty for disenrolling and then coming back? Let's see if she's there.
Yeah, she's there.
Hold on a second. Can you hear me now?
Yeah, it's pretty echoey though.
Can you hear me now? Is that better?
Still echoey.
It is.
Maybe you could just type your answer into the Q&A.
Yeah, that's what I'll do.
Okay. Okay, we'll get that answer.
We'll get that answer on that part, but as far as having it, dropping it, and trying to get it back later, yeah, it's Social Security. They have certain guidelines that they also, and they're always trying to make some money. So you never know. They may try to charge you a penalty on that. But we'll have to see. She'll provide a response to us in just a moment on that. Okay. All right. While she gives her a response, let's see what the next slide is. Okay. Now, here's the good thing about ACERA. And as I understand, no other agency does this for their retiree members. Okay. And I've been around here for over 32 years. So the ACERA, and this is not tied to having a medical plan with ACERA, because this is a years of service benefit. Okay. So as long as the retiree member, and this is only for the retiree member, not a dependent, as long as the retiree member has at least 10 years of service, okay, or a service-connected disability, okay, then, and you complete the MBRP reimbursement plan form application and provide us a copy of your Medicare card that shows that you have Part B and send that into ACERA, then on your monthly benefit from ACERA, how on the left side, you'll see your base amount, and then you see your cost of living adjustment. You'll see a new line that says Medicare Part B reimbursement plan. And that is, you'll see a credit of this 170.10. So we'll give you 170.10 on your monthly benefit. Okay. And if this, we're paying you this 170.10. So it doesn't mean that you don't have to pay your premium to Medicare for your Part B because we're giving it to you. No, we're not paying them, we're paying you. So basically they're taking the 170.10 or whatever premium they're costing you out of your pocket over there, but here in your ACERA pocket, we're giving you 170.10. Okay. So if they're going to charge you 170.10 for your Part B, that's fine, because we'll go ahead and pay that, because in your monthly benefit, we're going to go ahead and give you 170.10. So basically it's zero. It's zero net. You get it right back. If they're going to tell you that, hey, because of your income, that when we looked at your IRS stuff, we're going to charge you, $238. Okay, then go ahead and make sure you pay them that $238. But in your ACERA check, we're going to be giving you the 170.10. So you're not completely out of that for that full $238 or whatever the premium is that they're going to charge you. We only go up to 170.10. That's the base amount for the Medicare Part B that's they charge. And that is the amount that was approved by the Board of Retirement here. We go in front of the board every December and advise the board that, hey, we've been notified that from Social Security that Medicare is going to charge this amount as the base amount for the new year. Okay. And then the board goes ahead and every year they've been approving us to go ahead and increase this MBRP amount to match that minimum amount, that base amount that Medicare charges for the Part B. Okay, so you might be out, if you're not collecting Social Security, you might be out, you have to send out that 3-month benefit payment to them, because they bill you quarterly, but in your ACERA check, you're going to be seeing this monthly. So we're going to be giving you this monthly, but you would have to make sure that you pay that your premium to Medicare quarterly, or if they're not already deducting it out of your Social Security check. Okay. All right. Again, to qualify, 10 years of service, proof of medical enrollment into the Part B. Okay. And again, you do not have to be on an ACERA medical plan. You might be retired and on a medical plan through another agency that you retired from, or you might be on your spouse's medical plan through their employer, or through their retirement through their side. You can still apply for this and still get this reimbursement. Okay. And mind you, this is not a retroactive benefit. Okay. So for example, you become Medicare eligible September, but you don't submit this form to us because you went on vacation, or you got sidetracked, and you don't send it into us till November. Okay, then when we get it, that's where we're going to start it. We're not going to go retro back to September, because that's when your Medicare started, but you didn't submit all the necessary documentation. Okay, so it's not a retroactive benefit. So you want to make sure you complete the form and provide us a copy of the card as soon as possible. That way we can have it ready. It'll start the month in which we have everything in there. So again, don't just send us just the form and not the card, or send us the form and forget to send us the card, because then we got the form, but we never got the card. So now we got the card a month or two later. Okay, now we got everything that's required, but we don't go back. Okay, so I'll make sure you get us everything that's required for us to start this benefit. Okay, enrollment is not automatic. Okay, and again, you must complete the Medicare Part B reimbursement plan application form and provide us a copy of the card that shows that you had the Part B. Okay. All right.
Okay, and Yolanda typed in her answer to the original question of whether somebody can go after they retire, get Medicare, and then go back to work. Can they suspend Part B? And she said that as long as they're employed by an employer that employs 20 or more full and part-time workers, I guess, they can postpone enrollment initially. And then to the question, if they can go back to work, and so if they go back to work and the employer meets the requirements, the above requirements, which is that they have 20 or more full and part-time employees, and they're enrolled in health insurance through that employer during that time, they can stop Medicare and enroll later when they retire. And in order to have the penalties waived, they'll need to provide proof of insurance to Medicare. So let me know if I got any of that wrong, Yolanda.
Great news. Thank you, Yolanda. Thank you so much for assisting on that question there.
Okay, and she said that is correct. There's another question up on the board. And first of all, they're apologizing for being a long question. No worries. Okay, so here we go. I'm a retired safety member, and I don't have enough credits to be eligible for Social Security. My wife collects about $700 a month in Social Security. Now, I know that generally a spousal benefit exists that allows a non-eligible spouse to collect about half of that amount. So due to the Windfall Elimination Act and the government pension offset provisions within the Social Security system, I believe any benefit I might be eligible for as a spouse would possibly be reduced to zero. Is it even worth trying to sign up for the spousal benefit to help pay for Medicare Part B, or should I just plan to pay for Medicare Part B and then rely on the Part B reimbursement plan that ACERA offers?
Okay. Well, it's always good to try to see if there's any way possible, if you can get parts A and B.
If they're not going to penalize you for trying, right?
Yeah. Yeah, if you try to see if this with the spousal eligibility, if they can grant you your Part A without having to pay a premium for it, then that's good. That'd be great. Otherwise, just get Part B. Excuse me, just get the Part B, and we can get you onto the Kaiser Senior Advantage Part B only plan. Now, here's the one thing you want to keep in mind, though, okay, for anyone who doesn't get the Part A. On the individual side, okay, so the KIPSA plan, the Kaiser Senior Advantage plan, is an ACERA group plan. Okay, it's an employer group plan. So we have this agreement. We're able to do this with Kaiser and have you enrolled, even though you only have Part B as in boy. Okay, if for whatever reason you guys you relocate out of the service area of Kaiser, you decide to move out of state or whatever the case is, okay, and you're no longer eligible now for our Part B only Kaiser Senior Advantage plan. So now you're going to have to try to reach out to VIA Benefits and get enrolled in the Medicare plan over there. Now the problem is that on the individual side, I don't think you're going to find an individual carrier that's going to say, you know, it's okay to only have Part B. Typically, they want both. They want Part A and B, okay? Which means at that point, you would need to reach out to Social Security to try to get your A. And because you didn't get it all this time, they may charge you a penalty, okay? They'll give it to you as long as you pay. So, but how much they're going to charge you, that I can't say. I can't determine that. And that's if they're even going to do that. But I just want to put that out there as an FYI, in case you ever decide to get off the Kaiser Senior Advantage Part B only plan and relocate out somewhere else. Okay, just a heads up on that.
And Yolanda is saying that's correct. To enroll in the individual market, you need both A and B.
Yes. Thank you, Yolanda.
Okay, one more question. When Medicare takes their payment from my Social Security payment, will they also do that quarterly or monthly?
Well, if you're collecting a Social Security check, they take their premiums monthly. Okay, so they'll take it out of your Social Security check every month.
But if you're not taking Social Security yet, is that when they do it quarterly?
Then that's when they send you a bill saying this is how much you owe for the. Okay.
Okay, next question. Oh, shoot, I think okay, so they're saying if we plan to do the Kaiser program, we should still enroll in both Medicare A and B just in case.
Anytime you're eligible, Medicare eligible, you want to try to get A and B. Okay, always want to try to get A and B. The only time that someone would want to just, you always want to try to get A and B. If they tell you that they're going to charge you for the Part A, then just waive the A and get the B. Typically, the only members that we should be getting that's waiving the A are safety members, because since they didn't pay in, Medicare is going to try and charge them for the Part A. But to save them from having to pay that $499 a month, waive it and just get the B.
Okay.
Okay.
And then
You
Yolanda
always
is
want to try and
saying,
get both.
Yolanda is saying that the penalty for late enrollment for Part A is 2 times for the period you have not enrolled. So an example is if you have not enrolled in Part A for 2 years, you'll be penalized for 4 years, and it's 10% of the average Part A premium.
Yes.
Okay.
Okay.
And then last question, I will turn 65 this September. When I retire, I will delay taking Social Security until age 70. So the 2-year look back period will have my income to qualify for the base amount, correct?
Right. They're gonna do a 2-year look back for when you apply. So if you're gonna wait till you're 70 and you're applying, they're gonna look, okay, you're applying now. Let's see what you reported to IRS 2 years back. Okay. So it's from when you apply, contact them to apply.
Okay. Thanks.
Mm-hmm. All right. So Part D is in David, premiums by income. Okay. So when you're on our Kaiser Senior Advantage plan, okay, Part D is already built into it. The majority of plans have Part D prescription. They offer prescription, okay, which is Part D. Okay, so even though you're enrolled, so when you apply for Medicare, you don't have to apply for Part D, okay, because if you're going on a Senior Advantage plan, it's already built into it. Okay, so you may still get a notification bill from Medicare in regards to a Part D premium, and is known as an IRMA. Okay, it's an income-related monthly adjustment. Okay, so it's not that you're paying a premium to have Part D to Medicare. No, you're paying an adjustment income because you make over a certain dollar amount. Okay, so if we take a look at the first box at the top row to the far left, file individual tax return 91,000 or less. Scroll across, you pay each month, but it basically says your premium, but there's nothing there. You don't pay anything. Okay, you don't pay a penalty. If you're above the next row, above 91,000 to 114,000 is what you're reporting to the IRS. Scroll across, then Medicare is going to send you a bill for $12.40, for each month. Okay, so basically it's almost like being penalized for making decent money. Okay, so but it's not a premium to have Part D. This is just an adjustment that they are charging people, and they started doing this several years back when a bunch of the funds and so forth was reallocated by the government to something else. So to help recoup some of their funding and stuff like that, they started doing this adjustment premium that they call it. So basically, you may end up having to pay this amount if your income on your IRS tax returns are over a certain level. Okay, and you do have to pay this, because if you do not pay this, again, they'll disenroll you from your Medicare, which disenrolls you from your medical plan, and this just causes more trouble. So you got to go ahead and make sure you pay that amount if you get one of these bills. Okay.
Okay, Yolanda's got 2 comments. If they're retired, they need to enroll in Medicare when they become eligible. Okay. Comment number 2, the money is different from the insurance, so they cannot wait until 70 to apply for Medicare. If they're retired, they need to enroll when eligible and entitled to.
Mm-hmm. Yeah, unless you're on an employer plan, you want to enroll in Medicare right when you become eligible, unless you're on one of those, an employer group plan. Okay. Okay. All right. So there's types of Medicare plans. Okay. You have the Medicare Advantage plans. Okay. Which is basically like an HMO. You have a primary doctor. You have a primary medical group. Okay. You must go to your primary doctor to get a referral to go to a specialist. Most Medicare Advantage plans do have Part D, which is the prescription portion part of it. Copays can vary depending upon the plan structure that you enroll into, and you must reside in the service area of the plan. Okay, close to your medical group and doctor, so forth. Okay, so your Medicare is assigned to them. So if you went to your primary physician and the doctor said, hey, we found this and we need to do this and this and this, and that might not be something you really want to have done, you can't just go outside of your medical plan to some other doctor down the street somewhere and get a second opinion, because they're not going to pay. Okay, you can simply talk to your doctor about a second opinion and so forth, but you can't just go outside of the plan and expect Medicare to pay that other carrier, a doctor or what have you. Okay. On the Medigap plans or supplement plans, Medicare is not assigned to the medical carrier group. Okay, you do not have a primary physician. You might have a primary physician that you enjoy going to, okay, but they're not your primary physician. You're not assigned to that doctor. Okay, so basically with this, since Medicare is nationwide, you can go see any doctor that accepts Medicare nationwide. Okay, there's no referral needed to see a specialist. You can see any specialist nationwide that accepts Medicare. So for example, you're on this plan, the supplemental Medigap plan, and your doctor here that you went to go see say you need to have this type of surgery on your knee or whatever the case is, and you're looking around and you find the best specialist that handles that type of procedure his operation is in New York or Miami, whatever the case is. They accept Medicare. You can make an appointment and boom, go out there, have that nationwide specialist do the job, get it taken care of, because they accept Medicare. It's nationwide. Okay. These are also only medical. Okay, this Medigap and supplement plans are only medical. It does not have a prescription component, which is why if you went through via benefits to sign up for either Medicare Advantage plan or a Medigap supplemental plan, they will sign you up for one of these plans, but they'll also sign you up for a prescription drug plan. Okay, that way your prescriptions are covered. Okay, so you will need to enroll in a prescription Part D plan, and if you go through via benefits, they'll make sure you get all taken care of. They do have a prescription profiler. So when you make the call to via benefits, you want to make sure you have all your prescriptions with you. That way they can, they'll go to ask you, and you can tell them all the different prescriptions you're on, and they can enter it into this profiler that will search through all the different prescription drug plans and find the one that covers your meds and what the costs are for your copays and what the premium is. And you can do a comparison. Okay, well, this prescription drug plan covers all your meds that you're on, and this is the copay, and this is the premium. This other one covers majority of them. This is the copay, and this is what the premium is, and so that you can see where that's going to be falling, and you can make a decision which one you want to select to enroll into. Okay. Again, copays and possible deductibles may vary depending upon the plan selection that you choose. On supplement plans, they have different levels. So you want to make sure that you're talking with, when you're talking to them, finding out about if there's any deductibles, this, and they can explain which ones will probably best suit you. Okay. Again, this is the United States is the service area for these types of plans because that's where Medicare is covered. Medicare is all of the United States. Okay. Any questions? Again, ACERA-sponsored plans. Okay, what we have on the non-Medicare, of course, we have the Kaiser HMO. We have United Healthcare Signature Value HMO. And we have United Healthcare Signature Value Advantage HMO. Okay, now, when you become Medicare eligible, we only have Kaiser Permanente Senior Advantage. Okay, so members can just transition from Kaiser Permanente HMO, they can just transition right over to Kaiser Senior Advantage. Okay. We also have via benefits. So if you're on United Healthcare, one of the United Healthcare plans we have, and you don't want to go to Kaiser, then you want to contact via benefits to enroll into a plan over there. Now, on the individual side, okay, United Healthcare is a giant. Okay, so over there, you can tell that they're via benefits rep that you're currently with United Healthcare, and you want to stay with United Healthcare, but on a Medicare plan. And they'll find you a United Healthcare medical plan. By seeing that they're a giant, they bought up several other insurance companies. You may know, if you recall, Pacific Care, okay, Secure Horizons. Okay, there's several large other insurance companies that United Healthcare has purchased. So if you ever get something from Secure Horizons or Pacific Care, you take a look at the document that they send you. Towards the very bottom, somewhere in the small print, it'll say a subdivision of United Healthcare Medical, whatever the case is. So, it's still United Healthcare, but it's one of their insurance plans. So when you go over to via benefits, it may be a Secure Horizons plan, okay, or Pacific Care or something like that, but it's still United Healthcare. Okay, they're the big papa of the family of those plans. Okay. All right. Now, Kaiser Permanente Senior Advantage. Okay, so here's what the premiums are. Okay, our plan is only in California. Yes, they have Kaiser in other states throughout the United States. Okay, but our contract is with the California Kaiser. Okay, so to be on our Kaiser Senior Advantage, you have to be residing in California and in one of the service areas. Okay. Which keeps expanding because Kaiser is always building more facilities and expanding their footprint. So, which is a good thing. Okay, so it's only in California. For yourself, it's if one person by themselves, it's $344.44 for the Senior Advantage. If you and your dependent both have Senior Advantage, then it's $688.88. Okay, if only one of you have Medicare, then it's $1187.60. Okay. And then, of course, the family coverage. Right now, if you're on Kaiser Permanente, HMO, you know your copays are $15. Okay. When you go to Senior Advantage, your copays drops down to 10. Okay. So not only are you going to be saving on the premium, but with the copays, depending upon how many medications you got or how often you actually have to go to see your doctor, you know, from $15 down to 10 and $5 a pop, that starts to add up, especially if you're on quite a few medications. Hopefully you're not on a lot of medications, but some members are. But that's another way of savings. Okay. Now, for this current year of 2022, also added in with our Senior Advantage plan was a Senior Fit Gym membership. If you're enrolled in our Senior Advantage plan, okay, then you can always contact the number on there's a flyer for the Silver and Fit Gym membership, which allows you to go to a gym and work out and so forth. Okay. So again, we do require that if the retiree or dependent, you know, if you have Medicare or eligible for Medicare, you have to enroll upon your eligibility and enroll into a Medicare plan. Okay. And then, like I said, there is a Part B only plan available if it's applicable. If you're trying to charge it for the Part A premium, for Part B, Part A Medicare, you can waive that and just get the B, get you onto this plan. Okay. Now, again, effective February 1st of this year, Kaiser Permanente Silver Fit, which is great. It's a good exercise program. You can choose for the broad network participating fitness centers. I think they had over 16,000 different centers throughout California. You can do workout with cardio, strength training, all kinds of items you can do. When you sign up for this, they can also send you a home fitness kit. You may want to work out and just watch it online, the classes, and just work out within your own home using the fitness kit if you don't want to go into the actual gym itself. Okay, so you can either just get the gym stuff, or you can say, okay, yeah, I want the gym, but I also want a home kit, and they can go ahead and sign you up and send you your home kit just in case you want to work out at home because you don't want to go to the gym today. Okay, so and they can also get you started with the exercise plan, keep you nice and fit. All right. All right. So again, to learn more about that, you can call that 877 number. This information is also on our website. If you go to the Sarah website, you can click on it and access the Silver Fit stuff and be able to reach out and get started with this. Okay. This is a program that started this year. It's on a trial basis right now to see how our members like it and its utilization. So we're still under review to see whether or not we're going to be able to continue it, or if we're going to actually continue it next year or going forward. So we won't know that until the next. Hopefully, by open enrollment, we'll definitely have an idea whether or not we're going to be offering it continuously going forward or not. Okay. All right. So, via benefits and the Medicare plans. Okay, these plans are through the exchange. They're not a necessary group plan. Okay, so they're individual plans and will not show up on your monthly benefit statement from Sarah. Okay, right now you probably see your Kaiser deduction or your United Healthcare deduction. Get your Medicare, you go through via benefits. You're not going to see the medical deduction on your monthly benefit from Sarah. Okay. Members and dependents are solely responsible for paying the premium to these plan carriers because those are individual. We don't issue out any monies to the carrier to pay that plan for you. So you're responsible for paying your monthly premium to that carrier for you to maintain your medical plan. Okay. Now, members who are eligible for Sarah's monthly medical allowance, or we pay a subsidy credit towards your medical premium, will be granted a health reimbursement account for your medical out-of-pocket expenses up to the qualified amount, depending upon how many years of service you've provided. Okay, so yes, you'll be paying the premium directly to that other carrier, but then you can turn around and get reimbursed for that premium from via benefits. Okay, and a majority of those carriers, when they get your payment premium from you, they turn around and report to via benefits, hey, blah, 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 issued their premium to us in this amount. We've received our payment. Then via benefits can turn around and say, okay, great. They turn around and pull money out of the HRA account and reimburse okay, what you paid out of pocket. And this is for anything that's out of pocket, the medical, the prescriptions, office co-pays, you know, basically like medical equipment, okay, things like that. Medical out-of-pocket items, and it's only for the retiree member, not for dependents. Okay, so that's a really good benefit. So you can always make sure when you're signing up that you talk to, and here it is right here. You can always, when you're signing up through Via Benefits, that you let them know that you want to sign up for the recurring reimbursement. So basically, you know what your premium is. This is the premium that you're going to get charged to pay every month. Via Benefits can go ahead and set you up to get automatically reimbursed that premium every month. That way you don't have to worry about submitting a claim form every month. Also, you want to set up for the direct deposit. That way they can direct deposit your reimbursement right back to your account. Okay. And which is the safest thing. You know, people are stealing packages off the porches. They're going to people's mailboxes. You know, it's a wild world out there. So it's always better and safer to have your monies direct deposited back to your own account, especially in the event of some kind of natural disaster, whether it's a hurricane, a snowstorm, and so forth. You know, depending on where you live, you know, the mailman might not be able to get to you to hand you your checks and so forth. So as long as the money's going automatically into your account, that's a good thing. It saves you from having to go out there, and you're still able to do things online and check your money and issue payments and so forth. Okay. Again, enrollment with Via Benefits is done via phone interview. Okay, they don't have an office for you to walk into. There's no face-to-face. Carriers over there do require both Medicare Parts A and B. Okay. Most of the Medicare Advantage plans do have the Part D built in. So you want to make sure you talk about that when you're enrolling into a plan with them over there if you're doing that. Medigap, some plans are only medical. So you would need to enroll in this prescription drug plan to cover your prescriptions. And the representative knows this. So they will be trying to see, okay, they're going to ask you, do you need prescription drug coverage so we can get you enrolled into a plan? Okay. So a licensed benefit advisor will go over the plans in your area. Okay, and that way you can help you select which one that you would like to go to and what the premiums are and so forth. Again, plans are nationwide, so it doesn't matter where you are, or if you're here and you decide to relocate to somewhere sunny and warm, whatever the case is, you know, that's fine. You know, they can go ahead and make sure that plan that you're signing up for is taken care of. Okay. Reimbursement available. Okay, you can set up your an online registration to the Via Benefits, and you can check your balance. You can see if something's pending. You know, you'd be able to basically track where your reimbursement is, that it's being processed or whatever the case is. You'll be able to go ahead and access all that information. Okay. Again, they have auto pay and direct deposit available. Reimbursement for the current plan year must be claimed by March 31st of the following year. Okay, so every month we're putting money into this account, self-reimbursement account for you. Okay, December 31st, whatever balance you have, it's wiped out. And now January 1st starts the new plan year, and you have a new amount going in. So what about the balance that you still had at the end of the year, right at December? You still have some money in there that you didn't get to claim for? Well, you got to March 31st to be able to submit a claim against the balance that you had still at the end of the year. Okay, and it must be for services that you had for this year. Okay, because any services over that you have as of January 1st going forward, that's the new plan year. So then those claim items will go against the current year items. So that'll go against the 2023 items. But you have until March 31st to submit for any claims or out-of-pocket items that you had in 2022. Okay. All right. Again, online health reimbursement account tracking and status updates is also available there. All right, so here's what I was talking about, the prescription profiler. Medicare Part D adds hundreds of prescriptions to its database yearly. And this impacts Medicare prescription plans due to the changes in the formulary and possible costs. So, but by going to the prescription profiler in mid-October, you'll be able to get a prescription coverage information regarding any breakdown or drug costs for the year across different plans. And vast majority of members, they get into a medical plan when they're going through VIA, and they're usually pretty good. They're good to go. Okay. But I always tell members, always in October, always double check in with them regarding your prescriptions. Okay. Because you may have a set copay that you're comfortable with and a premium for that prescription plan, and that's great if everything's working fine for you. But you can always still just check in because you never know. There may be another prescription plan that may be offering the same benefits, same coverage for your prescriptions, but at lower copay and possibly even a lower premium. And that's your chance to say, okay, well, that'll save me some money. Go ahead and move me over to that one if you choose to do so. Okay, so that's what you want to do come mid-October if you're in a plan over there. So it's always good to check in just to make sure you're getting the best bang for your bucks. Okay. All right. Ooh, going so slow. We have to speed that up a little bit. Curtain must have got stuck. All right, here we go. Open enrollment. All right, so you all know that Sarah's open enrollment is the entire month of November. Okay, so you'll be getting your open enrollment packet from Sarah, early to mid-October. Okay, and so we'll talk about all the stuff that's going on, there's changes and so forth, and benefits and premiums and so forth. It's all that have to do our plans. So you'll get that. And that way you can make a decision if you do need to make a change for the month of November, in the month of November for the February 1st coverage. Okay, that's what our plan year is. Now, with VIA benefits, they are on the individual side. So they were based on Medicare's schedule also. So their open enrollment over there begins October 15th, okay, through December 7th, with elections to become effective January 1st. Okay, so their timeline's a little bit different. So if you're going over there, you can start reaching out to them as of October 15th, and you have until December 7th to make a choice as far as you're switching it around. Now with the Sarah, you only have the month of November to make a decision, a selection, submit your forms to us, so then we can start you going on for February 1st. Okay. Again, keep in mind your monthly retirement allowance must be sufficient to cover the elective healthcare plan. Okay, so if you're only getting a small benefit from Sarah, and the plan you want to go to is more than what that benefit is, well, we can't take it out because your benefit's not enough. So you want to be mindful and keep an eye on what the premiums are that when you make a selection. Okay, so here we go, and this is to show you how the trend has been for the last 3 years or 2 years. So you got 2020, 2021, and here's 2022. So on Sarah's plans and also on the non-Medicare plans for the HRA to VIA benefits, you see a 20-year member, 20 plus, gets $596.73 towards their premium. Okay. And if you're enrolled through VIA benefits, $596.73 is what's going into the health reimbursement account monthly for you to get reimbursed towards what you're paying out of pocket. Okay, and as you see, it goes down according to your years of service. On the individual Medicare plans through VIA benefits, okay, you can see 20+ year member or service-connected disability, they get $457.13. Okay, and of course it goes down from there. Now, I know I get this question quite a bit. So, well, why is it that, I'm a 20-something-year person, I was getting $596, now I go to VIA benefits, and now I'm only going to get $457. Okay, well, you're now switching over to a Medicare plan, which are extremely lower than what the non-Medicare plans are. Okay, so the way the formula went, it's kind of adjusted it and brought it down. Now, members who are over with VIA benefits, very few use up all the funds that we put in. I mean, yes, you can see it's 457 compared to the 596, but very, very few members use up all the money for the benefit year. Okay, so it's because the Medicare premiums on that side, on the individual side, are so much lower than what it is on a group benefits under Sarah. Okay, I mean, for example, I got I got a member who's enrolled in a Medicare Advantage plan over in, I believe she's in Georgia, and she's only paying like maybe $39, and her prescriptions are like $5. So of course she's never going to use up, unless she has some astronomical something that's out of pocket, she's never going to use up all the funds that we put into her HRA account. Okay, so then that's what you got to be aware of also when you're talking to the VA benefits regarding a plan. You want to make sure the plan has everything you need for your needs and medical coverage. Some plans may charge a high amount of premium, another one a lower amount, but actually it's the same coverage. Okay, well, that's going to happen. Carriers are going to, remember the name. It's just like if you go buy a pair of sunglasses, you get a pair of sunglasses at Walgreens. It looks identical to the Gucci or the Ray-Bans or Nikes, whatever that's at the Macy's. Okay, they look identical, but of course, it's what you're buying. Sometimes, yeah, it is quality, but also you got to basically do the comparison, because sometimes, depending upon the carrier, pretty much a lot of times you're buying the name. Is what you're doing, and also certain areas. The carriers have a large foothold because they're doing business there, where compared to other carriers may not be doing business. So that carrier, okay, you really don't have a choice because no one else is really working over here covering in this area. So this is what we're charging. If you want the coverage, this is what you got to pay. So, ask questions and let them provide you with what's available for you, and you can make a good decision as far as what's feasible and what's financially well for you. Okay. Slide. Again, qualifying events. Okay, well, a loss of coverage is a qualifying event. If for whatever reason, if you're not on our plan and you lost coverage, that's a qualifying event. So you've got 30 days to let us know, hey, I was on my plan with my other agency or my employer, and they stopped offering benefits, and I've lost coverage. Okay, let us know. Boom, we can get you see what we can get you into. Okay, or I was on my spouse's plan and their employer, they're not going to offer plans anymore. So we're losing coverage. Let us know. Let's see what we can do to get you covered. Okay, you got 30 days. Relocating out of the service area. You went on vacation, a road trip, you fell in love with this beautiful house elsewhere. You had to have it, you bought it, you relocated. Now you're out of the service area of your medical plan, because a lot of people that will relocate and not even think about that part. That am I still covered under my medical plan? Are they covering me in this area? Until after the fact. But so you reach out to us. We can double check to make sure. Hey, that house is going to be in the service area. You're good. Or no, it's not going to be in the service area. But here's the phone number you need to call to get a medical plan that's going to cover you in that area. Okay. Of course, we have the annual enrollment. And then we have becoming Medicare eligible. That's a qualifying event. Okay. Retiring after age 65. That's a qualifying event. Marriage. Love bug got you. You fell in love. You got married. Okay. Your new spouse needs coverage. Okay. You got married. Okay. 30 days from the date of marriage, you can still add them onto the coverage. Of course, new domestic partner. Okay. Fill out the SARA affidavit, domestic affidavit, and submit the enrollment form to add your domestic partner. Do that. Okay. Now you can't be within 6 months from having a prior domestic partner. If you have a domestic partner and things don't work out and you get them off, you got to wait 6 months before you can add a new domestic partner onto the medical coverage. Okay, that's that part.
Okay, there's a question. The current dental and VSP I have through Acera will continue?
Yes,
Okay.
this is just medical. It has dental and vision are completely separate. You don't have to worry about that changing anything because of becoming Medicare eligible.
Great.
All right. Again, moving out of the service area, don't forget to look into available health plans prior to moving. If you happen to relocate out, or if you're out, just like on vacation or something like that, you have emergency services through your carrier that you have with us. Okay, but if you're actually relocating, you want to make sure that wherever you're going, that is the plan covering, or do you need to find another plan? We can do what we can to assist you with that. Okay, so we'll definitely reach out to Sarah, and we do have team members here that can assist you with that. Okay, you must complete the Sarah address change form. Can't tell you how many members disappear once we activate a direct deposit and the money's going right at the bank. It's like they vanish. It's like we can't find them. We don't know where they are. Oh, but the money's getting used because it's going into direct deposit. But you always want to keep your address updated with us in case something happens and we need to send you something to notify you about something. Plus, if you're out of the service area and you go to the doctor somewhere and say, well, sorry, your coverage is terminated. Well, I never found out. Well, because we never had your address to be able to send you the notification. Okay, so always keep your address current with us. Phones and emails, if you got one, that'd be great. So retirees who reside outside of California may not be required to pay California state taxes. So again, that's another thing you want to keep in mind. If you're relocating out of California, then you want us to stop taking California state taxes. You don't want to be elsewhere in another state paying taxes over there, and yet here you're getting happy love letters from the California State Tax Board about paying money here. So, if you do relocate, give us an address, and if you want to stop paying California state tax, definitely fill out a state tax form. Remember to send us completed a Sarah address change name form request form, which can be found on our website at thesarah.org/forms. Okay. All right. I hope this is very informational for you. You can email any questions to us at info@sarah.org, and when it comes in, it'll get assigned to a team member, and they'll respond, providing you the information you need or the forms you may need. Okay. So it's always ready to assist you. So any questions from anyone?